Hello, I'm Dr. Douglas Drevets. I'm the Chief of Infectious Diseases at the University of Oklahoma Health Sciences Center, and I'm here to give you a weekly update on COVID-19. To start with, I wanted to say that worldwide there are just over 12 million cases today and nearly 550,000 deaths. There are now around 200,000 new cases reported each day, and the numbers of daily deaths globally, which had been falling, are now increasing again. Areas experiencing the greatest numbers of new cases in the world include the Indian subcontinent, South America, and the United States. The United States now has on average around 50,000 new cases each day, and sometimes 55 and probably 60,000 cases. And numbers of daily deaths are no longer falling, but have now plateaued. The majority of new cases are no longer in the northeastern states, New York, New Jersey, and Massachusetts, but are now south and west in states including Georgia, Florida, Texas, Arizona, and California. In Oklahoma, we have now nearly 18,000 cases in total. About 10% of these individuals have been hospitalized, and somewhere around 20 to 25% of those who are hospitalized are deceased. In the last 2 weeks, we are regularly setting records for numbers of new cases and numbers of new hospitalizations. Although the largest increases in the incidence of COVID-19 in Oklahoma have been in individuals in the 15 to 54-year age group, we are now also seeing substantial increases in individuals over the age of 65. This is important to note because it's these folks, the older folks, who are at the highest risk of having a poor outcome, and it indicates that we need to do a better job of protecting these individuals. Even with the substantial increases in new cases, more than 95% of Oklahomans remain susceptible to infection. There's much information coming out about the virus every day and the disease that it causes. We are learning things literally on a daily basis. This has helped healthcare providers reduce mortality rates of those who are hospitalized, and now several vaccine candidates are in human trials in the United States and across the world. Nevertheless, there is still much to learn. For example, although it's clear that younger individuals tend not to have severe cases of infection, there are now emerging reports indicating that even previously healthy individuals can have prolonged symptoms such as fatigue and shortness of breath. It's important that we remain vigilant, thoughtful, and calm in our efforts to live our lives while protecting the most vulnerable among us until a vaccine and better treatments are available. Now I'm happy to answer questions.
Start with Jacqueline from Channel 4. She says that a large argument from viewers is more testing is leading to more positive cases. Can you please explain that positive cases are increasing regardless of more testing, such as the state seeing a 10.9% increase of positive tests compared to last week's 7%?
Right, so we are doing much more testing than we were several months ago, and indeed we are picking up more new cases, in part because of the new testing. But as you look at the numbers of new tests, we also see a higher percentage of those tests are also positive. And it depends on how you look at your numbers, if you look at over 5-day periods or 7-day periods of time. But we are seeing substantial increases in the percentage of positive cases. And this is not just a reflection of more testing, it is indeed a reflection of more transmission in the community.
This morning, Dr. Bratzler said there is a lot of person-to-person spread, and I think that she means social society spread, I guess, or happening in Oklahoma, just as Texas had been experiencing. Please talk about what this means.
So I believe what the reporter is referring to is community spread, because all the spread is going to be from one person to another person. It just depends upon the setting. And we generally think of community spread versus something like hospital spread or within a family per se, or a known contact tracing type cluster. So community spread is where it's not in the hospital setting, and it's, as you would say, out in the community. So this could be in your home, transmission from an infected individual in a home to another individual in the house is extremely common. Spouses have a very high attack rate. as do other family members. We are also seeing individuals who are infected in community gatherings such as church or in parties. You can have community transmission in restaurants, bars, anytime where you're in with a group of people for a prolonged period of time in a closed space. And now all this is nuanced, and a prolonged period of time may be only 15 to 30 minutes. But if you're close enough and somebody is coughing, speaking, or doing other things that put particles in the air, you can get infected in a very short period of time.
Can the increase of positives be tied to an event or anything else that we've seen happening in our state recently?
So that's a tough question to answer precisely, because often we don't know exactly the date at which symptoms started, and often we don't know exactly the date that a particular test was drawn. What is reported is often the date that the lab test got transmitted to the state Department of Health. My recollection from the data is that we saw the biggest increase, or the first really big bump in the incidence of infection the week around June 12th to June 18th. What was happening before that, I don't really recall. I think we were just getting out and about more, and people were enjoying the increased lack of restrictions and increased mobility.
Maybe would Memorial Day be tied? Maybe would that be the timing be right on?
You know, that's possible. You know, it takes, on average, I think the state health department reports that it's about 3 days from onset of symptom to the report of a positive case, or the obtaining of the specimen. And if it takes on average, 5 days for somebody to develop symptoms from when they were infected, that gives about a week. So anywhere from a week to 10 days before that. So starting at the Memorial Day weekend and thereafter would be sort of a time that you could see increased transmission. And then we don't see the numbers go up for another 10 days or so.
If I'm tested today, I don't have symptoms, but I just want to be tested today for whatever reason, would it tell me up to this very minute I have not been exposed, or I don't have COVID? I mean, would yesterday's exposure to COVID to me show up on today's test? Does it happen that fast in your system?
So that's a great question, April. And we have to distinguish between an antibody test, which is a blood test, or a PCR test, which is most commonly done up in the nasopharynx and through the nose. And in general, the PCR test tells you about today and maybe a few days before that. If you are infected, say this morning, and when I say infected, if you're exposed to somebody who has disease, and let's say 5 days from now you become sick, and we know this is when you got it. So if we know that was when infected, if you were infected this morning and tested this afternoon, chances are you would be negative. You probably don't develop a positive test until about 2 to 3 days after you're infected, because it takes time for the virus to replicate and build up enough numbers for the test to detect.
So that's just more argument for why you have to be so diligent all the time with your social distancing and your masking. Because
in a sense, yes. The PCR test basically tells you your status today. You could be brewing the infection and get sick in a week, or you could go out and get exposed the next day and come down with it. It's really a snapshot of what's happening today.
Are there steps that you think that the state should take to help flatten the curve, like requiring masks and limiting indoor gatherings and closing certain businesses, things like that?
So this is a real hot topic of discussion, and obviously none of us like to wear masks, but we do it because we know it's the right thing to do. For myself, I don't wear a mask when I'm in my house, but I do wear a mask when I go out and go to the grocery store or go to buy something at another establishment. you know, we have to be smart about it. I also take care of patients, and I don't want to be the one who transmits disease to somebody else. And although most people don't also take care of patients, most people do have the opportunity to spread infection to somebody else. So really the things that you need to do to slow transmission and in a sense flatten that curve is indeed wear masks whenever possible and when reasonable and practical. If I'm out taking a walk by myself and there's nobody else around, my wearing a mask doesn't help me, it doesn't help anybody else. That said, if I'm in a crowd, if I'm walking with a group of people, then wearing a mask in that setting would be reasonable and would help prevent spread. Also depends on the kind of a mask that you're wearing. So, and even if the mask isn't one that may protect you, it still may to some degree decrease the amount of spit and things that go in the air. And remember, much of this is you're reducing chances, it's probability. You're changing a probability from say 50 to 70% to maybe 20 to 30%. Often things aren't absolute. In the hospital, we try to take special precautions, use all sorts of things, including the N95 respirators, eye protection, gowns, gloves, and special airflow to try to get that as close to zero as possible.
Chris Wilson with the Lawton Constitution wants to talk about masks. How do they work? Should people wear them? Who should wear them and who shouldn't wear them? And do they protect the wearer from the virus or protect others or both? And you've already kind of addressed that, but maybe.
Right, so that's a good question. They basically act as a filter. They filter things that go out and they filter things that come in. And you know, a mask is not a mask is not a mask. For example, if you have a one-ply thin fabric mask, it's not going to do much in terms of reducing the amount of virus that's going out or the amount of virus that you might take in. And you remember that you don't inhale viruses per se, you inhale the droplets that they're contained within. So it's not simply a virus that's up there, they're generally on a droplet of fluid of different sizes. And so surgical masks have a particular filter rating to them. The N95 respirators have a different filter rating with them. And so that's how they protect things.
Okay. Can a person contract the virus twice?
So that's a great question. And the answer is it's not clear yet. I think that answer will be clearly known in about 6 months. I was listening to a podcast today. It's called This Week in Virology. It's very well done. Some really excellent scientists and physicians discuss that. They were talking about a case in New York of an individual who clearly had symptomatic or mild COVID, was PCR positive, then was PCR negative twice, and then several weeks later was exposed to an active case, became PCR positive again with symptoms. And that suggested reinfection. But it's really difficult to prove that unless you can actually go in and sequence the virus that he had the first time, sequence it, the one that he had the second time, and show that they're different viruses. So what is clear is that although people do develop immune responses when they're infected, whether or not they have symptoms, it seems that their antibody levels are higher if they have symptoms than if they don't have symptoms. But you also develop immune lymphocytes, the so-called CD4 and CD8 cells, that also help infection. It seems to be clear that after a few months, the amount of antibody in your system tends to go down. And so it's just not clear how long the protection lasts after you've had the infection. So more to come on that answer.
Are there any other precautions besides masks and disinfectant and social distancing that we can help or we can do to help keep from getting it to protect ourselves?
So masks, other kinds of precautions, social distancing, Also, very good hand washing, because remember, if somebody coughs on their hand, opens a door, and then you grab that doorknob a few minutes later, you're going to pick up a whole bunch of viral particles on your hand. And then if you touch your nose, your face, your hands, your eyes, then you will infect yourself that way. So good attention to hand hygiene is also important. Beyond that, there's not much that you can do to prevent infection. The things that you can do to help yourself have a milder case or get better faster would be to, take care of your health in general. If you have diabetes, make sure it's under good control. If you have high blood pressure, make sure your blood pressure is under good control. Do those sorts of things. So it's general good health is often good.
This question is, there are some cases where people develop the symptoms, and then some where people don't develop the symptoms, but they still are positive. Why is that?
So the question is, why do some people have severe courses of the disease, and why do some people have absolutely no disease manifestations? So that's a great question. And the short answer is there are a couple of factors that go into whether or not you develop symptoms. One of which is how big of an amount of in this case, a virus are you exposed to? Are you exposed to 100,000 viral particles when you first get infected? Or are you exposed to 100 million viral particles when you're first infected? In general, the people who have a higher inoculum, as we say, are going to get sicker sooner and have more symptoms. Another thing that could be involved is the individual's own genetic background. Some individuals just may not make the same immune response to the same degree to this virus as other individuals. Also, elderly individuals tend to have a different response to viral infections than younger individuals. So part of that is just some of the normal effects of aging and how your body fights infections.
So that kind of leads to which positive patients would be most likely to have it so severe that might lead to death?
Right, so the folks who are going to have the roughest time with this are generally, in general, the ones who are older, and this is over the age of 65, and in many of the European studies, it's really focused on those over the age of 75, and also with underlying health conditions. Chronic kidney disease is shown to be a problem, liver disease, cardiovascular diseases are among the most important ones.
Cummings is asking, I'd like to ask about the current state of COVID. Has it changed any, mutated, become stronger or weaker and can we expect that it will so in the future?
So I think what the question is getting at is the virus itself, and is the virus itself changing? And so the short answer is going to be yes, to a degree. And you have to bear in mind this is an RNA virus, so in that sense it's like influenza and many other viruses. And these viruses are designed to change, and they change by mutation. And this is just the way they work, and this is how they survive in the environment. There has been at least one major change in the COVID-19 virus. It's an amino acid change in the spike protein, and it happened sometime in mid-March. And there was just a paper that was published that suggests that this virus produces higher amounts of virus in folks who are infected, and also may be more infectious because of that. There is no evidence, though, that it causes a more severe disease, and there is no evidence that it is in any way, shape, or form mutating to a stronger, so to speak, or it avoids the immune response any differently. Again, it's one of those things that there's a lot more work that needs to be done, and before you can actually prove that a change in a virus really impacts the disease that it causes, you have to put it in an animal model, and it would probably be a something like a primate model, non-human primate model would be the best way to test that.
The same reporter was asking why we are seeing less deaths now compared to March or when this first started.
So the question has to do, why are the deaths dropping even though nationally the numbers of infections were staying the same for quite some time? And I think this in part had to do with who was getting infected initially, both in Washington State, in New York, and then also, if you remember, in Oklahoma, some of the initial outbreaks were in nursing homes. So these were individuals who were older and were at much higher risk for having a severe outcome. As things have changed, you're shifting who gets infected to a younger demographic, and these are individuals who are probably going to survive infection. So one answer is it's, to a degree, it's infecting different people. Another answer is, I think with the experience from places such as in other parts of the world in taking care of patients with COVID, I think the healthcare providers are getting better and are having more knowledge about how to treat folks. And I think we're just doing a better job in getting folks through the illness.
Great answer. And do you recommend that Oklahomans get the test, the COVID-19 test, even if they are not having symptoms?
So that's a great question. And the question is, if you're not having any symptoms, should you go out and get tested? My general answer is no. If you are not having symptoms and you're not in a setting where you're likely to spread it to other people, then I recommend that you do not get tested. The folks who should get tested, let's say you're a care provider for an elderly parent, or you work in a situation where you're around a lot of other people and you cannot socially distance, or for some reason you can't wear a mask, or if you're in a crowded conditions, then you might want to think about getting tested. And obviously, if you develop symptoms and you go out and get tested, you should isolate yourself until you get your test results back. You know, just because you're developing symptoms doesn't mean it's going to be COVID. But if you feel sick and you feel sick enough to go get tested, then the right thing to do is to act as if you are infected, protect those around you until you get your results back.
And we are having people, if they're going to have a procedure or anything, or they're tested and then asked to be isolated until they get the results. Is that right?
That's correct. And I think most hospitals are doing that too. Yeah.
Cassandra at K4 is asking if it's safe for people to go to start attending conventions, which are starting back in the metro this weekend. I've not heard that.
Ah, jeepers. You know, it would be really hard for me to walk into a room of 300, 400, 1,000 people who were not all wearing masks and all staying away from me. So my advice would be, if there's a large group of individuals and they are not all wearing masks and not staying away from one another, then it seems like a perfect place to transmit a respiratory virus.
Okay, this is an interesting question. This is Carmen at the Oklahoman. Not sure if you would be able to answer this, but she's curious if you have thoughts about why COVID-19 has become so politicized, especially in thinking about other widespread sicknesses before this, polio, chickenpox, etc., have never been politicized like this. Not sure if there's an easy answer to that.
There is no easy answer to that, and I'm not sure that previous epidemics have never been politicized before. For example, you know, when syphilis first got to Europe somewhere in the 16th century, my recollection is the English called it the French disease and the French called it the Spanish disease. And so in a sense, it was even then a political topic. And I think this is just a reflection of the times that we live in, where these sorts of issues are likely to be spread and are likely to be discussed in a political context.
Very good answer. Okay. Okay, I have a, sorry, just this one, I'm getting some that are just coming in now. Was asking about hospital capacity right now. We know that Integris opened are opening their extra unit now at Deaconess. So in general, have you any idea or outlook of what the hospital situation is across the state?
So I don't have a good sense of the specific hospitals. I can tell you that we are setting records in the numbers of new hospitals almost every week. We have more folks hospitalized now than we did in the early part of, say, March or April. And I'm told that over 50% of the folks in our hospital beds are actually in intensive care unit beds. It seems that a reasonable strategy is not to push the hospital capacity, to their capacity, because we do need to do other things. Hospitals need to care for people other than simply COVID patients. It's all important, and we can't forget the rest of our healthcare system because we are so overwhelmed by COVID.
Okay. Is there anything else about asymptomatic carriers that we should know?
So I think the most important thing about asymptomatic carriers to know is that, somewhere around 40% of folks who can transmit COVID have no symptoms. And that percentage may even be higher if you include the people who are, quote, unquote, pre-symptomatic, meaning these are folks who are going to develop symptoms tomorrow. There are a cadre of folks who just don't develop symptoms. And this whole issue of asymptomatic spread makes this virus so difficult to control. And it also means that you have to essentially protect yourself at all times. And we did this on the OU campus very early on in the epidemic because we realized we cannot identify people who are going to have virus. You can come in for a broken ankle and have virus and spread it to your healthcare team. So very early on, we went to a universal masking policy, and I think the wisdom of that has been borne up by the numbers.
Okay, and I think this might be the last one, but it's asking about our masks, social distancing, and things like that. Are these the new normal, or you see it? He's saying, do you see this as temporary, or as something that will continue long-term for the world, for us?
Predictions are hard to make, especially about the future. My guess is that this is the new normal for now. My hope is that once we have vaccine available that's shown to be safe and efficacious, that it will be in high supply and a lot of people will avail themselves of it, and so that we can then develop what's called herd immunity so that the virus just can't sustain itself in the population. I can tell you my plan for myself and what I counsel my family, several of whom are in healthcare, is that we need to stay in masks and protect ourselves, until we get vaccines, until we know how good they are. Yeah, I think we have to plan that we're in this for the long haul, and if it ends up being a shorter haul, then we can all be thankful.
Quick add on to the asymptomatic carriers question. She wanted to know, but how does a person know that they're asymptomatic if they don't get the test? So that's sort of the ultimate question.
Yeah, that's a good question, and that I think speaks to the wisdom of masking. Obviously, if you're in a home situation with your spouse and your family, one of you, assuming that everybody is completely asymptomatic, you're right, one of you could have infection and in theory could spread it to somebody else. I'm not advocating wearing masks in the home unless you have an infected individual. But I think this is why we need to, as best as possible, be vigilant about masking when we're out and about mixing with other people in the public, because you just don't know. You don't know who has it. You don't know if you have it. And so you want to protect yourself from others, but you also want to protect others from yourself. Part of this is just simple kindness of thinking of other people other than yourself, and trying to do what you can do, even though it may not be perfect. It is what we can do for now.
Perfect. That looks like it. Well done. Anything you wanted to add, or?